All right, what's up, friends of Modus RX, and welcome back to another Modus RX video of weekly questions.
I'm Steve.
I'm Eric.
We have some questions in this hat, and we are going to let our office manager, Becky, here pick one out for us, and we're going to answer them for you.
I wonder what it's going to be this week.
Ooh, this is a good one. What are 3 reasons someone would have hip pain with squatting?
You taking this?
I think you got this. You're good.
I'll paper rock you for it.
All right.
Loser answers too.
All right, sounds good.
All right, 1, 2, 3, shoot. Ready?
Shoot for you.
All right, so
Okay.
what are 3 reasons someone would have hip pain with squatting?
Okay. A little bit of a loaded answer here, but it'd either be weakness of the hip or the stiff hip. Usually I see a lot of people in the gym, they'll do a lot of stretches for the hip. Maybe they'll take out the Band-Aid, pull up our distraction bands, and they'll put it around their hip, and they'll just spend time mobilizing. And sometimes that works, but more often than not, I'd say more than 50% of the time, it's usually some type of weakness in the hip complex.
Okay, another reason that somebody might have pain in their hip is because they have pain in their hip. Sometimes the painful experience can be from an actual irritability in the hip. A lot of times, I hate to use the words, but we're going to talk about arthritis, labral issues in the hip. It's not often, especially with our younger athletes, our younger individuals, but a lot of times that can be the root source of the pain. So obviously we'd have different tests and measures that we can come up with to identify if that's the case.
I guess I got another one. It might not be your hip. It could be somewhere. Usually it could be something in the spine. It could be something in your knee. It could be something in your ankles. So it might not be the hip.
Yeah, so those are the 3 main reasons. I like what you came up with. Yours seem more exciting than
Let's
mine.
dive a little
but,
bit deeper into that first reason that I gave, the weakness or the stiff hip. Usually what we see a lot of people do right before they squat is a lot of people, they might do an active warm-up, but what I typically have seen in the past and what I hear from patients or clients is they're usually stretching, right? Maybe they're getting down, doing something like this, leaning forward, or maybe they're getting into like a pigeon pose and holding it for X amount of time. Or even some people in some gyms, maybe you've seen one of these before. This is a distraction band, or also known as like a pull-up band. So maybe you take it around the rig, you put it around, you step into it, and I always see people typically doing pigeon with this, or maybe they're coming up and they want to get a lateral distraction, but do they know they want a lateral distraction? They're coming out and they're doing this, they're holding it, maybe they're pushing their knee out, they're holding it for 30 seconds, maybe a couple minutes. Or the real popular one that I always seem to see is people come over here, put it behind their glute here, and then they're doing a hip flexor stretch, right? But maybe they're arching way too much and they're not keeping their pelvis tucked and their abdomen's tucked. So maybe you're working on getting the front of the hip. You usually see that when people have stiffness in the hip, and then they usually start warming up and squatting. Or how many of you have seen something like this? Or maybe one of a smaller, like elastic, thinner one. So you're stepping in here and you see people come in here trying to get their glutes activated, right? That seems to be the buzz term, that activation. Or maybe they're actually doing some squats, lower than that though. But do you know why you're doing that mobilization? Do you know why you're stretching? Do you know why you're using this band? Is it to get glute activation? Well, if we're looking at a weak hip, do you need just lateral hip strength? Do you know that you need lateral hip strength? Have you been evaluated? Maybe you need more anterior, maybe you need more medial or inside hip strength, maybe you need more posterior. Do you just need more banded mobilization where you're pulling the joint out to the side? Does it need to be posterior? Does it need to be medial? Do we need to assess that? If you've been trying these things and you're not making any success and you still continue to have these hiccups or pain, it might be a good idea to be seen by a rehab specialist.
All right, I guess it's my turn now. We're going to talk about pain in the hip, and one of the main reasons that you can have pain in the hip is because of actual irritability or an inflammation of the hip joint itself. All right. Again, this is somewhat rare in terms of a lot of reasons for hip pain, but there is the possibility that you have a chemical irritation or an inflammation in the joint of the hip or in the labrum ligament that surrounds the hip. One of the things that happens a lot of times is in the hip, is that's a ball and socket joint. There can be some inefficiencies of the movement, and then you can get pinching or irritation of that ligament. So there's different movements that we know can trigger that. Squatting can be one of them. Certain rotations can be another one. But the classic sign of pain that's coming in that area, a reason that would be from the joint or from the ligament or the labrum of the hip, is going to be if you actually feel it right in the crease of the hip. So we call this the C sign, where if I ask somebody, where is your hip pain, and they go boom like this, and they kind of go right through the joint of the hip, it's not a guarantee, but we certainly want to start digging deeper in with that individual if that's a chemical irritation of that joint or of that labrum of the hip. So, some classic things that might be difficult for you, first of all, is depth with the squat, right? Because as we get down, there's got to be this dynamic at the hip where we go from outward rotation to inward rotation. You need to have a pretty healthy, efficient moving hip to get that depth, and you could get some pinching there from just the deeper squat. Sometimes it might be the movement where we're trying to drop the knee out to the side. So this is actually one of the tests we do, is if you have a hard time crossing your ankle over your knee, or you have a hard time putting your socks on, and again, you're feeling that in the crease of the hip as you come up and across like this, that could be a potential clue that that's something we want to look at farther. The other one is just kind of more of the internal rotation of the hip. So if I were to, say I'm focusing on this hip, if I were to try to bring my knee across, or I was trying to come up and across, and I feel that really intense pinch in there again, it could be, it's not a guarantee because there's other factors that we could talk about, but it could be a guarantee, or it could be a sign that irritation, that irritability is coming from the joint, coming from the labrum. So these are some things that we would obviously test and assess and make sure that's what we're up against. And then the first goal with something like that is to put the fire out. So we have all sorts of variations of treatments that we can do to try to reduce that pain and that irritation, to put the fire out for you, to go into some of those other strategies that Steve was talking about.
Go into that. Let's go dive deeper into that third topic that I mentioned. We're going to talk about it might not be the hip. There's so many different variations of squats, right? We have single leg squats, we got Bulgarian split squats, and there's so many different split squats and variations you can do within itself. And then there's so many variations with the barbell, dumbbells, kettlebells, all that stuff we can do, body weight squats. So let's talk about, something that maybe you've been on Instagram or TikTok or something, and you've seen like the great overhead squat, right? What's the classic thing we see is, well, we need so much in the overhead squat, right? Well, what's a tell sign you might have seen on some of these videos is someone drops their chest, they come down, then you look at the bottom there, a lot of air underneath those feet, right? And I can't get to depth. Now, is that going to be a hip issue? Well, I don't think so, because I'm not getting the full depth, and you saw how I wasn't able to keep my feet all the way on the floor, right? And then the other thing is, what if you're seeing full depth of the hip, you're seeing the ankle stay on the ground, like in an overhead squat here, you're going all the way down, but you're seeing someone who's like this, they're hunched all over forward, and maybe they're complaining of, could be shoulder issues. Do they have enough extension of the trunk to do that? Same thing in the front squat, right? It could be the same thing, because different barbell placements, wherever we have our weight or our load coming from, is going to place different external forces on our body. That's going to be a different core demand on our body, a core strength thing. It's going to be different different loads on our joints. It's going to ask different things of us. So it might not be the hip. Okay, so let's review what we went over. We went over, you could be having hip pain with squatting, 3 reasons. We did weakness and maybe stiffness of the hip. We talked about the painful hip, where it could be more chemically driven from inflammation, maybe a joint, a ligament, maybe some of the soft tissue structures like the muscles. And lastly, we talked about it might not be the hip. It could be coming from further up the hip, maybe your spine, shoulder, it could be even in your feet.
That's right. So if this sounds like something that you have been dealing with, any of these things are things that you've tried, or you're curious about more information and how we treat the hip, comment below and let us know, and we'll see if we can't get a conversation started to help you today. Thanks so much for watching.